Well, Community Health Network is the only health system in the state to offer a cutting-edge treatment called Neuravive. The procedure uses ultrasound to alter tissue in the brain to relieve hand tremors. Business of Health reporter Kylie Valletta has more. Kylie.
Thanks, Gary. It's fascinating. The most amazing feature of Neuravive is that while it alters tissue deep in the brain, there are no incisions, no implants. This is all done with the patient awake inside an MRI scanner. Neuravive uses high-intensity, focused ultrasound, which does not require radiation. And joining me now to tell us more about the new treatment is Dr. Jill Donaldson, a neurosurgeon at Community Health. Thank you for being on the show today.
Yeah, thanks so much, Kylie. It's a pleasure to be here.
Well, let's start with essential tremor. That's what this treats. Can you explain what that condition is?
Yes. So in terms of tremor, you usually group them into two categories. There's the essential tremor, which the tremor is worse when you go to use your hand, such as picking up a utensil or a glass of water, as opposed to a resting tremor, which is more pronounced when not using the hand and the arm.
And this can really be pretty debilitating in some cases, right?
It can. I mean, generally it starts fairly mild and it can progress over time. And, typically they start with medications and they usually control it for a while, but the tremor can progress even with medical therapy to where patients truly struggle to feed themselves. They can't drink a glass of water without chipping teeth. They can't dress themselves. It can be truly disabling.
Okay, so let's talk about what Neuravive is. Can you explain it and give us the basics of how it works?
Sure. So the Neuravive is a high-frequency focused ultrasound treatment. The way it works, most patients like to have their dominant hand treated. So we're actually creating a tiny lesion. In layman's terms, we're burning a tiny hole in the thalamus of the brain in a specific nucleus by using ultrasound. And it's where hundreds of ultrasound beams, where they crisscross, that creates heat. So it's a thermal ablation deep within the brain.
And I think, go ahead.
Oh, I think that's just the tremor center of the thalamus that we're treating to make the tremor go away.
Okay, and one fascinating part about this is that the patient is actually awake while you're doing the treatment. Can you explain how that allows you to make some adjustments?
Yes, it's imperative that they're awake, and it's very interactive. So we actually do this as a series of sonications. It's not like we set a target, hit a button, and we're done. We start with relatively low temperature, low frequency, kind of align the ultrasound, make sure that we like the spot size and shape, location, and then we gradually increase the temperature, and we can get into a temperature range where we'll see a reversible effect. So we start to see the tremor gradually getting better. We can also ask them if they're having any numbness or tingling anywhere, because if they are in their face or their hand, that actually helps us map a little bit and adjust the target a little bit to get the best possible outcome for the tremor. And then we just gradually treat the tremor, and they're on their back on the MRI table, and we just slide them in and out. I hold a clipboard and we test their tremor to have them draw pictures, write their name, hold a cup of water, make sure that we really are getting the right positive effect and the tremor is getting better with the treatment.
So interesting. So just personally, as a neurosurgeon, does this have a pretty high cool factor for you?
Yes, it's off the charts. This is a really amazing new technology, and we're blessed in neurosurgery that there's always interesting technology, but this is extremely fun to do, and it's really rewarding personally.
And heard that the patients are coming from out of state, many of them, for this treatment, right?
That's true. So yeah, more than half of them do travel to Indiana, to Community North to have this done. There are not a lot of places in the United States offering it at this time, and some of the other places have a long wait list and we have a shorter wait list, so they can come here to have it done.
So what have some of the patients' reactions been after getting this treatment?
Some of them are tearful. I mean, it is something that, it's really hard to not have good use of your hands. And, if you can really improve that. And, the first thing they usually want is a cup of coffee, because we don't want them to eat or drink in the morning, and they can hold their cup of coffee and they're just really, I've seen a lot of adult tears of joy. It's really amazing.
So before Neuravive, how was essential tremor treated previously?
So, like I said, everyone starts with medical therapy, but in terms of, disabling tremor, we have deep brain stimulation, which is an implanted device. Before deep brain stimulation came along in the 1990s, you actually could do it the old-fashioned way, drill a small hole in the skull and pass an electrode and heat the tip of it up in the thalamus. And that was more of an open ablation procedure where you literally do pass an electrode and burn a tiny hole in the brain to make the tremor better.
So are there any other applications for this ultrasound technology?
So they do have like the high frequency ultrasound, which is what we're using to treat the tremor. They also have low frequency ultrasound. Some of the other applications are more experimental at this point. They have tried to use the high frequency because that's actually causing an ablation. They're tried using it for tumor treatments and other things. The low frequency ultrasound has the opposite effect. It actually improves brain function. So they have used that with memory and Alzheimer's kind of experimentally to help improve memory centers of the brain and things like that. I don't think that there's anything approved on that realm yet.
All right, well, fascinating technology. Thanks for being on the show today and telling us more about it.
Thanks so much.